Hi, this is Dr. Dumestri. So I'm going to chat about itching after surgery and a couple things that can be done to relieve it. So multifactorial when we're talking about like breast reduction or a tummy tuck. So one is the itch along the incision, and two is the itch from liposuction if you've had that done. So itch from the incision typically does start around that week period as things are getting a little bit dry. So typically you have a skin tape that's placed over your incisions at the time of surgery, and often your surgeon will have you leave the tapes on for a week or two, and then either have you remove them or we remove them for you. So if you're at a week out and your surgeon's okay with you taking off the tapes and you're having a lot of itch, probably related to dryness, then you can simply take them off and put some Aquaphor on them to rehydrate for a few days before putting some tape back on. If your surgeon wants you to wait until they see you, there's not a ton to do about incisional itch. I mean, you can try some over-the-counter antihistamines, but I haven't heard like Benadryl, Reactine, but I haven't heard that they are particularly successful. Once you are able to remove that tape, then moisturizing with Aquaphor and beginning some gentle scar massage starting at post-op week 3. So once you're 3 weeks out from surgery, if all your incisions are healed, then rubbing the scar with some moisture. It can be anything you want, but something without really anything in it, like an Aquaphor, along your incision can help to decrease that itch. And you can actually go quite firm, either circular, squeezing, or you can even pick up the scar and roll it a little bit. As far as liposuction, the itch is partially from all of your nerves waking up. So when we do lipo, it's a big cannula that goes in there and selectively removes the fat, and it basically bruises all the nerves around it. So initially you're quite numb, and then as that feeling starts to come back, people describe it as this creepy, crawly, tingly, deep, itchy feeling that they can't quite get. So there's a couple things that help with this. One is a medication called gabapentin, which helps to decrease nerve pain. Secondary is lymphatic massage, where they actually help to decrease some of the swelling, and some of that stimulation also helps to relieve some of that itch. Otherwise, it's something that tends to get better within the first month or so in general with both incisional and liposuction itch. Have a great day.